If you're anything like me, when cold weather comes around, the struggle is real. And you can expect to have little piggy problems, otherwise known as chilblains. So, what exactly are chilblains? Also known as pernio or perniosis, chilblains are the painful inflammation of small blood vessels in your skin that occur in response to repeated exposure to cold air. It's like an abnormal reaction when your body is exposed to cold temperatures, followed by rapid rewarming. Rewarming your skin can cause small blood vessels under the skin to expand more quickly than the nearby larger blood vessels can handle. This results in a bottleneck effect and the blood leaking into nearby tissues. Chilblains can cause small itchy red patches on your hands and feet, usually on the toes and/or fingers. It can cause blistering or skin ulcers, swelling of your skin, a burning sensation on your skin, numbness, and changes in skin color from red to dark blue accompanied by pain. To prevent chilblains, avoid or limit your exposure to cold temperatures. Dress in layers of loose clothing and wear mittens and warm water-resistant footwear. Cover all exposed skin as completely as possible when going outside in cold weather. Keep your hands, feet, and face dry and warm. Keep your home and workplace comfortably warm. Make sure you are not doing anything to restrict blood circulation. If your skin is exposed to cold, it's helpful to rewarm it gradually because sudden rewarming of cold skin may worsen chilblains. Avoid extreme temperatures on the inflamed areas. This also means avoid using hot or cold water on the affected areas. Otherwise, your skin might feel like it's on fire. Chilblains mostly affect me in my feet. As a preventative measure or as soon as I feel it acting up, I do a foot massage. Start by wearing soft, comfortable socks. Using your palms, gently massage your toes in a circular manner. This will help gradually warm your feet and stimulate circulation. Do this for a few minutes. Then massage the toes upward, sort of like you're pulling on them. Do this for a few minutes. Next, massage the toes as vigorously as you can stand. This may be painful if you're already experiencing painful toes and feet, but I found this method most effective for quicker relief. Do this for a few minutes. Massage the areas below the base of the toes as well, on the top of your feet and the ball of your feet. Do this massage a few times throughout the day or as needed. If you're experiencing chilblains in your hands and you're able to, massage one hand at a time using the other hand. Do this for a few minutes. Do this massage a few times throughout the day or as needed. For best results, ask a loved one to give you a hand massage. Chilblains will usually get better on their own, but to be on the safe side, seek medical care if the pain is severe, if you suspect an infection, or if your symptoms aren't improving after 1 to 2 weeks. If the symptoms extend into the warm season, see a doctor to rule out other conditions. If you found my video helpful, please like and share with family and friends. Thanks for watching.